Many people over 60 believe that walking every day is enough to stay healthy. But in reality, it isn't sufficient to prevent physical decline. Over time, muscles become weaker, balance decreases, and reflexes slow down, increasing the risk of falls and loss of independence. Without strength and coordination exercises, the joints are not properly supported, which can lead to back pain, knee discomfort, and difficulty standing up or sitting down. This is a quiet, often overlooked problem, but it has a direct impact on quality of life in older age. Heel raises are one of the simplest yet most valuable exercises for people over 60. Especially for improving circulation, balance, and preventing falls. Few people realize that the calf muscles are often called the body's second heart. Each time the calves contract, they help push blood from the feet back up toward the heart. Working against gravity. As we age, reduced activity, long periods of sitting, or only light walking can weaken these muscles, leading to poor circulation, heavy or swollen legs, cramps, and ongoing fatigue. Heel raises help reactivate this natural blood pumping mechanism in a safe and effective way. When practiced regularly, you may notice a warming sensation in the lower legs, a sign that circulation is improving. This exercise is especially suitable for older adults because it requires no equipment, places minimal stress on the knees or spine, and can be done almost anywhere, in the living room, by the kitchen counter, or even while watching TV. The movement itself is very simple. Stand upright with your feet about shoulder width apart, lightly holding onto a wall or the back of a chair for balance. Slowly rise up onto the balls of your feet, lifting your heels and holding the position for about 2 seconds. Then lower your heels back down in a controlled way. You can also reverse the movement by lifting your toes and shifting your weight onto your heels to activate the muscles at the front of the lower leg. Aim for about 15 to 20 repetitions, breathing steadily and avoiding rushed movements. For beginners or those with limited strength, this exercise can also be done while sitting. Simply place your feet flat on the floor and lift your heels up and down in a smooth, rhythmic motion. Even though it looks simple, doing this consistently throughout the day can bring noticeable benefits. Gentle repetition is the key to waking up the muscles without overloading them. Beyond improving circulation, heel raises help strengthen the ankles, a crucial factor in preventing falls. Strong, flexible ankles improve balance and reaction time when you stumble. This exercise may also help reduce cold feet, tingling, nighttime leg fatigue, and contribute to a greater sense of stability while walking. For people with mild varicose veins, heel raises can be beneficial when done correctly and consistently. However, if there is significant swelling, pain, or serious vascular disease, it's best to consult a healthcare professional before starting. Overall, this is a small movement with big benefits, helping restore strength and vitality from the ground up. When your legs are strong, your body feels more confident, more mobile, and safer in everyday life. Wall push-ups are one of the safest, most effective, and easiest exercises for people over 60. Unlike floor push-ups, which require significant strength and place more stress on the joints, the wall version allows the body to move gently while still providing well-rounded benefits for the upper body. This makes it an ideal exercise for improving posture, strengthening the arms, shoulders, and chest, and supporting healthy breathing without unnecessary risk. Over time, many older adults develop a rounded upper back and forward drooping shoulders due to prolonged sitting, reduced activity, or weakening back and chest muscles. This posture not only affects appearance but also reduces lung capacity, leading to shorter, shallower breathing and quicker fatigue. Wall push-ups help wake up the muscles that support the shoulders and spine, encouraging a more upright posture, opening the chest, and making it easier to breathe deeply. The exercise is simple to perform. Stand facing a sturdy wall, about an arm's length away. Place your hands on the wall at shoulder height, fingers pointing upward. Keep your body in a straight line from head to heels, without arching your lower back or stiffening your body. Slowly inhale as you bend your elbows and bring your chest toward the wall. Then exhale as you push yourself back to the starting position. Each movement should be slow, controlled, and coordinated with steady breathing. This exercise works several important muscle groups, including the chest, shoulders, triceps, upper back, and even the deep core muscles. As these muscles become stronger, the body can maintain proper posture more naturally, reducing strain on the neck and spine. Many people notice less neck and shoulder discomfort, better posture, and easier breathing after practicing regularly. Another important benefit of wall push-ups is their positive effect on bone health. When muscles contract and place gentle stress on the bones, they stimulate bone remodeling, which can help slow bone loss. This is especially important for older adults, particularly postmenopausal women. Although gentle, the exercise provides enough stimulus to encourage safe adaptation. Beyond the physical benefits, wall push-ups can also support mental well-being. An open chest and upright posture are linked to improved mood, reduced feelings of fatigue, and greater alertness. Many people find that after practicing consistently for a few days, they feel more confident, less tired, and more motivated to stay active in daily life. Beginners can start with 8 to 10 repetitions per day and gradually increase to 15 to 20 as strength improves. To make the exercise more challenging, simply stand a little farther from the wall. If you have shoulder issues, high blood pressure, or experience dizziness, move slowly and consider consulting a healthcare professional. When done correctly and consistently, wall push-ups are more than just an exercise. They are a simple, practical tool for maintaining posture, strength, and long-term confidence in everyday movement. Among all daily movements, none is more important for older adults than the ability to sit down and stand up. This action is repeated dozens of times a day. Getting up from a chair or bed, using the toilet, or getting in and out of a car. When this ability declines, people don't just become physically weaker, they also begin to lose independence. That is why the supported sit-to-stand exercise, often called a chair squat, is considered a foundational movement for maintaining independence after age 60. Over time, the muscle groups responsible for this movement, including the quadriceps, glutes, hamstrings, and deep core muscles, gradually weaken if they are not properly activated. As a result, standing up becomes slower and more difficult, often requiring the use of the arms or assistance from others. Chair squats help reactivate this entire muscle chain in a safe, controlled way that is well suited to older adults. The exercise is simple and can be adjusted to individual ability. Start with a sturdy chair placed against a wall so it won't slide. Stand in front of the chair with your feet about shoulder width apart, toes pointing slightly outward in a natural position. Keep your back straight and your eyes looking forward. As you begin, inhale and slowly bend your knees while pushing your hips back, as if preparing to sit. Lower yourself until your hips lightly touch the chair. Then exhale and press through your legs to stand back up. You may place your hands on your thighs or lightly hold the chair for extra support if needed. This movement strengthens the thighs and glute muscles, two key muscle groups responsible for walking, climbing stairs, and maintaining balance. At the same time, chair squats activate the core muscles, helping stabilize the body and reduce stress on the spine. When these muscles work together, movement becomes smoother and safer, significantly lowering the risk of falls. Beyond muscle strength, the sit-to-stand movement also improves coordination between the brain and the body. Each repetition requires balance control, spatial awareness, and force regulation, which helps sharpen reflexes over time. Research shows that older adults who practice this movement regularly tend to maintain better mobility and motor memory than those who are less active. For beginners, starting with 8 to 10 repetitions per day is enough. Performed slowly with attention to proper form rather than speed. As strength improves, This can be increased to 12 to 15 repetitions or divided into 2 to 3 short sets throughout the day. If you have knee arthritis, hip pain, or a joint replacement, it's important to limit the depth of the movement and consult a healthcare professional before practicing. Most importantly, chair squats are not just a physical exercise, they carry deep psychological value as well. Each time someone stands up independently without assistance, it reinforces confidence and a sense of control over their body. This simple movement supports dignity, independence, and long-term quality of life as we age. Marching in place with high knees is a simple yet highly effective exercise for people over 60. Especially for those who have difficulty walking outdoors or worry about the risk of falling. This movement mimics natural walking but is done in one spot, making it safer, more controlled, and easier to manage. As a result, it still provides cardiovascular and mobility benefits without requiring much space or uneven terrain. When you alternately lift your knees, the body engages multiple muscle groups at once, including the hip flexors, thighs, glutes, abdominal muscles, and the stabilizing muscles around the spine. At the same time, coordinating arm and leg movements stimulates the central nervous system, improving coordination and reaction speed. This is especially important for fall prevention in older adults, since many falls happen due to poor coordination or delayed reactions. The exercise is easy to perform. Stand upright with your feet about hip-width apart and your back in a natural, relaxed position. You may stand near a wall or chair for light support if needed. Begin by lifting one knee to a comfortable height while moving the opposite arm forward. As in a natural walking motion, lower the leg and switch sides. Keep a steady, moderate pace and breathe normally. The goal is not to lift the knees as high as possible, but to lift them with control and maintain good balance. One unique benefit of this exercise is its combination of gentle cardiovascular training and muscle strengthening. As you lift your knees, the heart works a bit harder to pump blood to the active muscles, helping improve circulation, support healthy blood pressure, and build overall endurance. At the same time, the rhythmic muscle contractions reduce joint stiffness, improve flexibility, and gently warm up the entire body. Beyond physical benefits, marching in place with high knees also has positive effects on brain function. Studies show that coordinated, rhythmic movements increase blood flow to the brain and support alertness and focus. For older adults, this can help maintain memory, reaction speed, and confidence in everyday movement. Beginners can start with 30 to 60 seconds per round. Rest briefly, and repeat 2 to 3 times a day. As endurance improves, the duration can be increased or the knees lifted slightly higher for added challenge. If dizziness, shortness of breath, or chest discomfort occurs, stop immediately and rest. Individuals with heart conditions, high blood pressure, or balance issues should move slowly and consult a healthcare professional before practicing regularly. Marching in place with high knees is more than just an exercise. It's a reminder that movement remains possible and beneficial at any age. Just a few minutes a day can help build stamina, flexibility, and confidence in your body's ability to move safely and independently. The glute bridge is one of the most important exercises for people over 60 because it directly targets the muscle groups that support the entire body: the glutes, lower back, and deep core muscles. These muscles often weaken due to prolonged sitting, reduced activity, or the natural aging process. When they become weak, more stress is placed on the spine, increasing the risk of lower back pain, hip stiffness, and reduced mobility. Practicing glute bridges regularly helps restore stability, build strength, and protect the spine in a safe and effective way. The exercise is performed lying on your back on the floor or on an exercise mat. Bend your knees and place your feet flat on the ground, hip-width apart. Rest your arms alongside your body with your palms facing down for support. Before lifting, take a deep breath. As you exhale, gently tighten your abdominal muscles and slowly lift your hips until your shoulders, hips, and knees form a straight line. Hold this position for about 2 to 3 seconds, feeling your glute muscles engage. Then slowly lower your hips back down. The key to this exercise is not how high you lift your hips, but how well you control the movement and connect with your muscles. When done correctly, the glute bridge activates the entire posterior chain, including the glutes, hamstrings, and lower back, helping improve posture and reduce strain on the spine. For older adults who often experience lower back discomfort, this movement wakes up muscles that may have become inactive, allowing the spine to be better supported during daily activities. In addition to easing back discomfort, glute bridges help improve hip mobility and build strength needed for everyday actions such as standing up, sitting down, and walking. These are essential movements for maintaining independence. When the glute muscles are strong, walking becomes more stable, steps feel more secure, and the risk of falls is significantly reduced. Another often overlooked benefit is improved circulation in the pelvic area. The gentle lifting and lowering of the hips promotes blood flow, helps reduce stiffness, and relieves tension in the lower back and hips. For older adults who often feel stiff upon waking, a few gentle glute bridges can help the body wake up more comfortably. Beginners can start with 8 to 10 repetitions per set, resting briefly and repeating for 2 to 3 sets depending on their comfort level. As strength improves, you can hold the top position a bit longer or gradually increase the number of repetitions. If you have serious spinal conditions, disc herniation, or acute pain, it's important to consult a healthcare professional before starting. When practiced correctly and consistently, the glute bridge is not just an exercise, it is a foundation for maintaining strength, stability, and long-term quality of life. Before starting any exercise program, especially if you are over 60, remember that every body has its own limits. Exercise is only truly beneficial when it is done correctly, slowly, and in a way that matches your personal health condition. If you have heart disease, high blood pressure, diabetes, joint degeneration, or a history of bone or joint surgery, be sure to talk with your doctor or a healthcare professional before getting started. During exercise, if you feel dizzy, experience chest pain, shortness of breath, or unusual increases in pain, stop immediately. Keep in mind, doing a little consistently is far more effective than doing a lot and then giving up. Just 10 to 15 minutes a day can already make a noticeable difference in strength, balance, and flexibility. Moving the right way not only helps you stay physically healthier, but also supports confidence, independence, and a better quality of life each day. If you found this content helpful, please tap like to support it. Share it with family or friends who may benefit from healthy aging guidance. And subscribe to the channel so you don't miss future videos about safe movement, healthy living, and staying active with joy. Your support is what motivates us to continue sharing helpful and positive content with more people.